So if you're looking for an organization that will always give you up-to-date information about nursing, that is Passcode Global Consultants. And we believe that by doing so, we are able to help so many nurses to achieve their dreams. So without much ado, let's go to the new generation NCLEX and look at it and what is changing. So people might be asking, why are we talking about new generation NCLEX? We are talking about new generation NCLEX because the NCLEX changes after every 3 years. The change for the change we are talking about now has been delayed actually a little because of the effects of COVID-19. The NCLEX that is being done right now up to the end of March 2023 came into effect in 2019. So it was supposed to be done for 2020, 2021, 2022. However, a review was done in 2020, towards the end of 2020, as a response to the pandemic, COVID-19 pandemic. And that was not the major change that they do after every 3 years. That was just a measure to respond to COVID-19. But all through, they have been doing implementing a change or coming up with a change that they will implement, which is called the new generation NCLEX. So any person who is preparing for NCLEX and they are not going to get, they will not be able to get their authorization to test ATT, but to be able to schedule their exam in January 2023, because we're in January, there is still time. In February 2023 or in March 2023, they will have to do the new generation NCLEX, and which means that they will have to study for some time before they can do their exam. So I do have a presentation which I'm going to share. All right, thank you. So this is a presentation for the new generation NCLEX, which is going to be administered from the 1st of April, 2023. So first of all, let us ask ourselves, what is NCLEX? So NCLEX stands for, some people like calling it NCLEX, NCLEX, I'm not sure about that, but it doesn't matter how you call it, provided that you're able to understand the questions and pass the exam and become an RN, a registered nurse in the US. So NCLEX stands for National Council Licensure Examination. Most of the countries have nursing councils. So the General Council for the whole of United States is called NCSBN. NCSBN stands for National Council of State Boards of Nursing. So what happens in the US is that every state has their own council of nursing, which is called a State Board of Nursing. For instance, if you're talking about Florida, it will be the Florida State Board of Nursing. If you're talking about Colorado, it will be Colorado State Board of Nursing. So all these boards of nursing have come together to form what is called National Council of State Boards of Nursing. And this is the body that is responsible for the NCLEX, because NCLEX is a standard exam that is used to give to licensed nurses in the whole of the United States. It was adopted in Canada. So nurses willing to practice in Canada will also need to take NCLEX. And recently in 2022, Australia has adopted the NCLEX as their gateway to licensing nurses who have studied outside Australia. So to me, NCLEX is like an international passport for nurses that allows them to practice in the whole of North America, market population of about 400 million people. And Australia, you can still use the NCLEX. Now, the outgoing version of the NCLEX, as I have said, has been administered for 2019 to 2022. And the number of questions in the NCLEX that is outgoing were 75 to 145 questions. That means when you sit the exam, you have to do a minimum of 75 questions. That is where the computer will start determining whether you have passed the exam or not. We usually have a lecture that we do that is called How NCLEX Works. It's a whole explanation of about 1 hour and over about how the NCLEX works because it's a CAT. I'm going to talk about that in a few minutes. Yeah, so actually this was an upgrade because before September 2020, those who did the NCLEX were doing up to a maximum of 265 questions, minimum 75, maximum 265 questions. So this was like a relief when they moved from the maximum of 265 to 145. So the new generation NCLEX debuts in 1st April 2023, and it will be implemented up to March 2026. So if you don't take the new generation NCLEX and you'll be doing your NCLEX after March 2026, then you'll be doing a new version of the NCLEX altogether. Another new version, that is. The number of questions in the new generation NCLEX will be 85 to 150. So you have to do a minimum of 85 questions. We are now moving from 75 to 85 questions. Now, the current NCLEX question types. Why do we have this slide here? We have this slide here because for the people who have not familiarized with the NCLEX, we need to understand what types are in the NCLEX right now so that we can know what is changing and how the exam is changing. So the main type of question in the NCLEX is called multiple choice question. I believe all of you, majority of you are familiar with the multiple choice question. The only difference is that the multiple choice question for the NCLEX is a bit tricky. It's not a direct question. It needs critical thinking, clinical reasoning, and clinical judgment. You must apply your knowledge to do critical thinking for you to answer that question. You cannot just answer it with elementary knowledge, because if you do so, you're going to fail. Another type of question in the current NCLEX is called a SATA, select all that apply question, which is nicknamed SATA. This is a question type that people don't like because it's a question type whereby you can have more than one answers. It's a multiple choice question, but instead of you selecting one, you don't know the number of answers. So they will give you like 5 options or 6 options, and they will not tell you how many answers are there. So the disadvantage of it is that you must choose all the correct answers. If you choose more than the correct answers in the current NCLEX, you fail the question. If the answers are 3 and you choose 2 correct, 1 wrong, you fail the question. So that was kind of unfair. You will see what has happened to it now in the new generation NCLEX. The next type question, which is a bit rare, is hotspot question. Hotspot question is whereby they bring you a photo and then they need you to mark. They ask you about something and they want you to mark. For example, they can bring a picture of maybe a bare chest, and then they will, the software they will be using will allow you to mark with an X, where, for example, you get to listen to the heart sounds or maybe lung sounds, maybe a particular heart sound, something like that. That's what is called a spot question type in the NCLEX. It's there, but it's rare, not very common. So audio or video question, they can bring you an audio, for example, lung sounds. Maybe they can bring you ronchi, for example, or a wheeze. And then they can ask you to identify the sound, or normally they don't ask simple questions like identify the sound. They make it a bit complicated, like they ask you to describe the sound. So there are some words that are used to describe a ronchi that differentiates it from a wheeze. So it will be upon you now to be able to identify and also recall the words that are used to describe. A multiple choice question with graphics. They can bring a question, but now the answer options will be graphics or pictures. So you choose one picture. For instance, they might be asking you about nursing positions. Maybe a client who has undergone a lumbar puncture. And then they ask you, after doing the lumbar puncture, in what position should the nurse place the client? So instead of listing the positions for you, they bring you the pictures. So you choose one of the graphics. Another type of question they can bring is a graphic. For example, EKGs, ECGs, they can bring an ECG strip, maybe for ventricular tachycardia or ventricular fibrillation. Then they ask you, the nurse did this and this and this for this patient. After seeing that rhythm, what should the nurse do next? Or what should the nurse do first? Or what is the best action by the nurse? So it will be upon you to know this is a VTAC, then you are able to interpret the ventricular tachycardia so that you can make a decision as an RN. So the other type of question they bring is a drag and drop. Drag and drop question is type of question whereby they give a list of questions, a list of steps on one side, and then you have to arrange those steps on the other side. So you will be dragging the step, then you move it to the other side. And what they're looking at here is whether you know how steps should follow one another in a procedure, in a nursing procedure. Some of the common procedures that may have been asked in the current NCLEX include catheterization, both male and female, tracheostomy suctioning, or tracheostomy care, and so on and so forth. The other type of question is fill in the blank calculations. They bring mathematics. For example, when you are doing drug administration and you have to calculate the dosage, they usually also do that. They can bring that. Then instead of giving you options like in the MCQs, then they will give you a gap. Then you fill the gap. You write your answer there. So those are the common types that we have today in the current NCLEX. All right. So let's go to the next slide and see what is there. So what is not changing? Before we know what is changing, it's important for us to know what is not changing in the NCLEX. So the first thing that is not changing is the nature of the exam. The current NCLEX is administered as a CAT. In full, this is computer adaptive testing, CAT. So the difficulty of a question will be determined by your result of the previous question. So what happens in computer adaptive questions is that the computer adapts to your level of knowledge, okay? So that when you do the first question, you get it right, the computer is going to give you a harder question to try you and to see in which level are you operating from. If you fail the first question, the computer is going to give you a lesser difficult question. If you fail the second question, it will still give you another lesser difficult question. So your graph will be going down. If you pass questions, your graph will be going up. So at the end of it all, when the computer is evaluating the minimum number of questions, it will be looking at, have you answered more difficult questions, whether you have failed them or not, or passed, or you have answered more easier questions. So at the end of them, your minimum, if you have answered more easier questions, you fail the exam. If you have answered more difficult questions, you pass the exam. So that's how the computer algorithm operates. And that's how it determines whether you have passed or you have failed. So that's one thing that is not changing. The next thing that is not changing in the NCLEX is the current question types. The question types that I have just shown you, those ones that are on your screen right now, are not changing. So they can be brought. You can get them in the NCLEX. So all these, you can get a multiple choice question, select other apply will be there, hotspot will be there, audio will be there, videos will be there. They can show you a video and ask your question. Multiple choice with graphics can be there. Drag and drop can be there. Fill in the blanks will be there. Okay, so that is not changing. So it's not that the exam is changing entirely, but the style of the exam is changing entirely. Okay, so let's now look at what is changing. What are the new changes in the NCLEX? All right. So the time remains 5 hours. You have 5 hours to do a minimum of 85 questions and a maximum of 150 questions. All right. So your exam can stop anywhere between 85 questions and 150 questions. Some of you will do 85 questions, others will do 150 questions, others will do between 85 and 150. The computer can stop anywhere between 85 and 150 after it has made a judgment that you have passed. Now, 52 questions from the 8 content areas. We have content areas in the NCLEX curriculum the NCLEX has a curriculum. Nursing is very wide. So the NCSBN has developed a curriculum for the NCLEX, the areas that they test, and they have divided it into 8 content areas per the newly released guidance for 2023, the latest one. So of the 85 questions that we'll be doing, 52 questions will be coming from the 8 content areas. That means for you to pass the NCLEX, you must be very good with nursing content, specifically NCLEX content as per the curriculum for 2023. Of the 85 questions, 18 questions will be 3 clinical judgment case studies. The case studies that are coming, are being brought in the new generation NCLEX will be having 6 questions per case study. So that is one major change that has not been the NCLEX. So if they are bringing you 3 clinical judgment case studies, and those will be considered as 18 questions because each question has 6 questions in it. So if you add 52 and 18, that gives you, I think, 70, and you are going to 85. So you have 15 items remaining. These are unscored pretest items. They don't score the 15 questions. These questions are research questions for the next NCLEX that will be done, will be implemented in 2026. So even in the current NCLEX, people have been doing a minimum of 75 questions. So of those 75 questions, as I have listed here, 60 questions were scored. 15 questions were not being scored because they were pre-test questions or research questions for the new generation NCLEX that is coming up in March 2023. So even you, when you go to do the NCLEX, you will do for them 15 questions for their own research. But these ones will not be scored. But the problem is you will not know which questions. So you will still have to do them and pass them if you want to pass the NCLEX. Now, all breaks are included in the 5-hour limits. The NCLEX gives you 2 breaks within that 5-hour period. If you have to be there the whole of 5-hour period. And those breaks are included in the 5-hour limit. So if you go for a break for 20 minutes, you are eating into your time. So it's upon you. But if you don't go for break, and maybe you are pressed with a full bladder, and the blood now will start stimulating your sympathetic system, you'll not be able to function well, then you'll not be able to answer questions well. So it is not a question of whether you go for a break or not, but it's a question of how do you manage your breaks. In fact, apart from the 2 breaks that are given, you can ask for another break if you feel that you are not concentrating and you save yourself from failing that exam. Like for guys here who are not who are not South Africans, you know that you have to travel all the way to Johannesburg, and you have to do you have to pay for air ticket, a lot of money, and that is it's very important therefore that you go and pass the exam. Okay. All right. So let's look at the types of questions that you will be expecting in the NCLEX, the new NCLEX. What is changing. So among the case studies, we will have different types of questions, which I'm going to show you today. Now, the main question that's coming up is a case study, case scenarios. A case will be presented with patient data. Then you will be asked questions from that patient data. Actually, if I can take you back, one of the other reason why the NCLEX is changing, the NCSBN has said that they want to make the NCLEX as real as possible. They want to present you with like real client scenarios. They want to see how you can manage a patient. So in my own perspective, one of the things that is happening with the NCLEX right now is that the person who is going to pass this NCLEX, the new generation NCLEX, has to be a person who is practically thinking about the patient. Your perspective of thinking must be about the patient as a nurse. This is where real nursing is. And it's real nursing that is accompanied with a lot of knowledge. You must be knowledgeable. You must be knowing how to respond when the situation of the patient changes. Because these case scenarios, what they are doing, they are, the NCSBN or the test setters, they are playing with patient scenarios. You are treating a patient who is aspirating at 80%, 80% in terms of oxygen saturation. And then you're expecting them to improve after giving oxygen. You give oxygen, they are not improving. What are you supposed to do next? Or maybe you are doing a CPR, you do breaths, you do chest compressions, your patient is not improving. What are you supposed to do next? So the person who has to pass this NCLEX has to be very knowledgeable in terms of patient management. That is where they are heading to. And actually, it's not far, April 1st. So let's look at the kinds of questions that can be asked in these case scenarios. Actually, case scenarios is not a type of question really, but this is a major introduction to the NCLEX. Most of the question types now will be asked from the case scenarios, the data that will be given. So one question type is an extended multiple response. This is a SATA, select other apply question, the one I talked about. But now the difference between this one and the previous one is that in the new generation NCLEX, they are going to give partial marks. So if you get some questions right, they give you marks for that, even if you leave some others that are right. But at the same time, if you answer if you give some wrong answers in a SATA, you get negative marks. All right. So that's the change. So even though there will be partial marks, it will be very important for you to give correct answers. Okay. The next type of question is an extended drag and drop. This will be similar to the current, but with more options, some of which will not be used. So in my opinion, it's like they have made this one a bit harder, because in the previous NCLEX, the one that is current now, there were drag and drop questions, but you were to use all the options. When you are ordering, for example, showing the steps of a procedure. In the new generation NCLEX, they will give you like 10 options to order in a drag and drop question, but you're not going to use all of them. You will use like 7, but they will not tell you how many you are going to use, okay? And some of them probably will be looking similar. For those of you who have done IELTS, I think I can give an example with that. If you have done IELTS, especially IELTS reading, where you are supposed to give headings for paragraphs, they want to give you like 5 headings, but they give you 7 options. So that is what is going to happen to drag and drop questions in the NCLEX, new generation NCLEX. So they give you more options, but you're going to use like less of the options. And you don't know how many, and you don't know which ones. All right. The next type of question is called a drop-down question or a clause. So this one will have, the drop-down may have more responses. So I'm going to show you this. Is whereby you have, it's actually like an options question. You just click the drop-down arrow, then you choose, and then you leave it there as the answer. The next one will be a matrix question, clinical data provided in a chart or table for candidate to make a decision. I'm going to show you that. The next one is an enhanced hotspot. A hotspot that is a bit more complex than the one we had in the previous NCLEX. So the bottom line is, are these people making the exam harder? I don't think so, and I don't know. Maybe I don't know that. But what I know is that what they have said is that they want to make it more realistic in terms of nurse-patient interaction. Okay. All right. So how do you pass this NCLEX? How do you pass this NCLEX? The decision to change the NCLEX is not for you to make. It has already been made, and the NCLEX is going to change. All right? There's a lot of information about the current NCLEX anywhere in the internet, with your friends who have passed NCLEX, with your friends who have not passed NCLEX. with your relatives in the US, with your linkages in YouTube, but we don't have a lot of materials for the new generation NCLEX. And in my own projection, we will be having enough reliable material for the new generation NCLEX, maybe after 1 year of implementation, maybe in 2024. Does this mean people are not going to do NCLEX? No, people are going to do NCLEX and they are going to pass because the content is the same. The content has not changed. So when you have someone who is very good at patient management, at the level which the US requires, this person is going to pass NCLEX because what you're having are the case studies for the patients that you manage in the ward. So you have to do intense review of nursing content. You must be knowing what you're doing. You must be smart, but you cannot be smart without doing intense review of the content. You must know what you're supposed to do. You must know that. Please underline the word must. Reviewing as many NCLEX types questions as possible. This will help you to have the intense knowledge I'm talking about. And then you can join a training institution. There are those of you who want to be trained by a friend. It's okay. I don't know whether that friend will have enough time to train you, but people are very different. So that one I leave to you. But what we do at Passcode, we do everything to ensure that you are prepared very well to go and pass the NCLEX. Walking the journey with a mentor. Yes, you can have a mentor because this journey is not easy. You are revising for I will not say a very hard exam, but I will say a very demanding exam. At the same time, you have a family to take care of. At the same time, you have a job to take care of. At the same time, you have bills to pay. You have other costs, and you also have costs for the NCLEX. Whether you are being sponsored by an agent or you are doing self-sponsored program like the one NCLEX offers, you will still need money for this process, all right? So let me now show you the types of questions. Now, if you look at my screen, courtesy of NCSBN, you will see this type of question. So let me try to show you this question. Don't know, just a minute, some Zoom tabs are blocking me from view, so I want to remove them here. Okay, so look at this question. This is one of the type of question that I was talking to you about. So the question reads, the nurse in the pediatric unit is caring for a 6-month-old client. Then the nursing notes are here. At this in some countries is called the nursing cardex. At 8 a.m. or 0800 hours, client admitted with increased irritability and a leaking gastrostomy feeding tube, which was placed 2 weeks ago for failure to drive, blah, blah, blah. So many things there, including the vital signs, a lot of explanation there. And then the nurse is reviewing the client's assessment data to provide the client's plan of care. The question is here now. Complete the diagram by dragging. So we talked about drag and drop question. Eh? So you can listen to what the question is talking about. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. 2 actions the nurse should take to address that condition, and 2 parameters the nurse should monitor to assess the client's progress. So here you have action to take, condition most likely experiencing here, and then parameters to monitor. So you will come here, you can see you have been given 1, 2, 3, 4, 5. You have been given 5 actions you are supposed to take to choose 2. And then here, you are supposed to choose the condition the client is suffering from. You have been given 1, 2, 3, 4. So this is like an MCQ. This is like a SATA. So you can see the way they have played with the questions and blended them in one question. And then here you have been given 1, 2, 3, 4, 5 options, you have to choose 2. Which ones are you going to choose? It's upon you now to have the knowledge of this client to be able to know which action to choose. So this is a type of a question which combines many questions into one. It has a multiple response question here. It has a drag and drop in that you have to do that to drag. And then this is like an MCQ. You have 4 options. You have to choose one here. So let's go to the next example. This is another example. The home health nurse is caring for a 2-month-old client. All right. Nursing notes are there. Weekly visits. Visit 1, 10 a.m. The nurse took data there. Weekly visit 2, 10:30 a.m. Weekly visit 3. So you can see this is a duration of 3 weeks. The nurse has been following this client. So the question tells you, drag words from the choices below to fill in the blank in the following sentence. The nurse should anticipate that the physician will instruct the parent to, okay? So what choices? Fortify the breast milk, you drag it and put it here, if it's your answer. Complete a feeding log, if it's your answer, you drag it here. Feed the client formula for 2 weeks, drag and drop it here if it's your answer. Increase the client's caloric intake, drag it here if it's your answer. Consult a pediatric surgeon for placement of gastrostomy tube, place it here if it's your answer. So the thing is, you are not choosing all this, dragging them and bringing them here, and then you complete your task. No, you are dragging only the answers. Have you been told how many answers? No. So you have options 1, 2, 3, 4, 5. How many answers should you choose? I don't know, because you have not been told how many. You use your knowledge to choose the answers. If the answers are 3, you choose 3 correct answers, you get the marks for the whole question. If you choose 2 and you don't choose a wrong answer, you get 2 marks. If you choose 2 and 1 wrong answer, you get 2 minus 1, so you'll have 1, all right? So that's how it's being marked. Next example. This is a drop-down question. So the nurse in the long-term care facility is caring for a 19-year-old client. All the information, nursing notes is there. You can see there's another tab for history and physical assessment. There's a tab for vital signs. There's a tab for laboratory results. You are supposed to click and read all of them for you to be able to answer the question. Then the nurse has reviewed the nurse's notes from 11:30 and has collaborated with the registered nurse. Okay, let's see that. So the nurse should recognize that the client is most likely experiencing. So you will click select, then you will see the options: an infection, autonomic dysreflexia, an abdominal aneurysm. So you just click your answer, then it will be left there. Next question, sample. The nurse in the long-term care facility is caring for a 19-year-old client, might be the same client, but that's the same client, but now this is a different type of a question. So which of the following would require immediate follow-up? How many options have you been given? 7 options. Have you been told how many they need? No. So you come here and choose maybe respirations, pylor, erection, blood pressure, maybe the 3 of them. So this is what we are calling an extended multiple response. It's like a SATA. Another example, the nurse in the medical surgical unit is caring for a 38-year-old female client. You can see progress notes, physical history and physical examination, diagnostic results, laboratory results. The notes are there. The diagnostic results are there. Then they ask you this question. You can see now this is a different type of a question. It's a chart. So they tell you, for each potential nursing intervention, click to specify whether the intervention is indicated or not indicated for the postoperative care of the client. So if it's indicated, you tick. If it's not indicated, you tick. But of course, for each, you have to choose whether indicated or not indicated. So you have to go back to your notes, all right? And that's the end of the presentation. about New Generation NCLEX. I want to believe that you have learned something, and from today you understand very well the changes that are happening in the New Generation NCLEX.